Welcome, and Lauren here today with another great training. Today I want to talk about some of the risks associated with seasonal affective disorder, also known as SAD. So let's go on ahead and get started. Now, the relationship between lack of daylight and depression that is associated with seasonal affective disorder is not going to be something that everyone understands. During winter, many people may find that their biological clocks will no longer match their daily schedules, and this can be the trigger that leads to depression. The body's hormone, melatonin, may also play a large role in the development of SAD. This hormone is normally produced at higher levels when a person is confronted with little to no daylight. During the winter months, the days are usually shorter, making the nights seem longer. And this has been linked to an increase in depression. Now, there are some experts that think that a lack of sunlight leads to a decrease in the production of serotonin, which affects our moods. Heredity has also been linked to seasonal affective disorder, meaning many people who have the condition may also have a relative who has been diagnosed with a mental disorder. When women have a higher risk of developing SAD, and it tends to show up more in women who are in their 20s. Also, men and children are prone to developing seasonal affective disorder. Feeling isolated is another symptom of SAD. Someone suffering from this disorder tend to remove him or herself from normal social circles. They may not want to be bothered by anyone, which can lead to hurting many family members and friends. The risk of seasonal affective disorder can be increased if someone is going through a very difficult time in their life. And if they are alone, they may feel as if they have no one to turn to. And this can lead to feelings of depression and ultimately thoughts of suicide. Understanding the symptoms of seasonal affective disorder is the first step in the right direction. Ultimately, you may need to get help, most likely from a psychiatrist who will more than likely prescribe you medication to address the feelings of depression. Some other symptoms that can help, or actually some other methods that can help your SAD symptoms that are more natural, include getting out early in the morning. Even if there's little to no daylight, this can actually help. Also, exercising for at least 30 minutes a day, 5 days a week is also helpful. Eating healthier is also a good thing, because most times during the winter months, many people start to crave carbohydrates. Another thing that you can do is get a full spectrum lamp that generates at least 10,000 lux light. Now, this is referred to as light therapy or phototherapy, and this is not only for those who suffer from SAD, but also for those who work indoors during the day, work at night, and lastly, those who suffer from jet lag due to constant traveling. Now, most healthcare professionals recommend people using light therapy to start slowly. A sample program may look like this. On day 1, you use the lamp for about 15 minutes at 10,000 lux. Day 2, you do the same thing. Day 3, you increase exposure to 20 minutes. Day 4, you repeat. And day 5, you increase exposure to 30 minutes. Now, please note this is not a medical prescription or advice. Only your doctor can recommend the appropriate amount of time you should spend using phototherapy. This sample is provided as an example of how many doctors may approach light therapy to their patients. The reality is, suffering from seasonal affective disorder for many of us is a choice, meaning ignoring the symptoms will not help. There are many ways to overcome the symptoms of SAD, and it's just a matter of choice as to what you are willing to do. Now, we at Best SAD Therapy Lamps are here to help. Actually, go visit our website to get more information. That's all I had for you today. If you have any questions or you want more information, please call us at 866-284-6296. You can also email us at orders@bestsadtherapylamps.com. Until next time, thank you.